Hi everyone, good evening. And this is Kannan, the Program Director for Master in Pharmacy Practice. I would like to welcome you all for this virtual postgraduate info week, the live webinar, day one on pharmacy practice. Here we have a set of speakers with myself, Ms. Chong Kamun, Ms. Farah Wasim, and Mr. Jody Ong. We are here to talk about the Master in Pharmacy Practice program. And the objective of this particular session is to introduce what the IMU Master in Pharmacy Practice program offers and share the opportunities with aspiring individuals like you who are looking to improve your skill sets, create an impact on their professional practice, and fast forward your career trajectories. Before that, I would like to mention the housekeeping rules. We have muted the microphones of all the attendees. And for the questions and feedback, please use the Q&A session. And you can keep your questions in the Q&A box. And the live webinar will be recorded. Okay. Coming back to this question, why should you consider a postgraduate studies in pharmacy practice at this moment? So to all the participants, I have two questions. Has the COVID-19 pandemic made you change your career goals? And have you developed any new skills in recent times? You may answer these questions in the chat box, or you can tell your answers opening microphone. Okay, so let us move on further. Why should you consider a postgraduate studies in pharmacy practice? First thing first, the industry is growing. The growing healthcare industry currently is challenging the established roles and responsibilities of healthcare professionals. That includes pharmacists. So when there are challenges in your current roles and responsibilities, it is also creating new demands from you. And when there is a new demand, that also offers new opportunities. So the question is, are you prepared to get into the new opportunities or establish yourself as a professional in the new opportunities? So when you think about new opportunities, obviously you'll be thinking about upskilling or upgrading yourself with masters. So why you choose master in pharmacy practice at IMU? You all know that IMU is Malaysia's first private medical and health sciences university with 29 years of dedicated focus in healthcare education. And more interestingly and importantly, we have got Setara 6-star rating in 2017 and 2019 consecutively. So that is indicating our quality of the programs we are offering. And the pharmacy practice program itself, it has a flexibility and support for working professionals to learn and grow. In fact, when we designed this program first, we have kept the working pharmacists in our mind and prepared the program content and delivery. So the MPP program is distinctive. You may ask why. This is the only program in Malaysia which has 4 streams to choose. Even though the program name is Master in Pharmacy Practice, we have 4 different streams to choose for the pharmacists or pharmacy graduates. The first one is clinical pharmacy, next is social and administrative pharmacy, then pharmacy management, and the fourth one is clinical research. These 4 specializations are the major specializations in pharmacy practice in Malaysia and abroad. So you may be interested in clinical pharmacy or social pharmacy or pharmacy management or clinical research. You can take this program. So when you see the program structure, in the modules, you will be able to see various difference in the modules. The clinical pharmacy or social pharmacy or pharmacy management or clinical research has different set of modules, even though we are sharing some of the common modules like research methodology and scientific writing and research project. The individual streams have different modules that will make you specialist in that particular area. That is why this is a good opportunity for everyone who are thinking about further advancing in their career. So, apart from the program structure, the teaching and learning delivery also an interesting thing in MPP. In MPP program, we are following adult learning principles that makes you, the students, feel safe and will allow you to explore. And we have experience teaching fraternity. They will help our students to learn by themselves continuously. And also you have an opportunity to learn from real world scenarios. We call it as experiential learning, where you will be learn from the hospitals, industry, and community. We are providing support for research and development because it is a mixed mode program. You will be having research element in the program. So our students are learning to do research and they are researching to learn also. We are engaging hospitals, community, and industry, which will allow our students to learn from their workplace. That's why most of our assignments or in-course assessments are based on workplace-based learning. So you may ask, because there is a pandemic, there are a lot of problems in delivering the programs. How is the MPP program being taught during pandemic? We have adopted blended learning approach from the beginning. Even before pandemic, we are offering our program in blended mode. We are using variety of delivery methods to keep our students engaged. So during this pandemic, we have moved to synchronous and asynchronous online sessions. And also we have recorded the live sessions to keep this live sessions for students to refer anytime, anywhere. And most of the live sessions are synchronous. And sometimes if the busy schedule, if you miss any of the live sessions also, the sessions will be recorded and will be available for you and you can use it. And moreover, we have provided additional support and flexibility for our students and lecturers. So the lecturers also working from home and the students are also sometimes we have allowed them to be at their workplace and attend the classes. So even though the face-to-face classes are scheduled in the weekends, you will be able to attend the classes from your home or from your workplace. So overall, our program has an outcome-based curriculum. The delivery is about blended learning approach and the delivery is fully online now. And the Department of Pharmacy Practice have experienced academic staff members. And of course, IMU has a very strong quality assurance process. All these things together will help you to achieve your employment and academic ambition from the MPP program. Let me introduce the next speaker, Ms. Chang Kaman, who's our student from MPP 220 cohort, who is also a graduate from IMU B Pharm. Currently, she is doing Master in Pharmacy Practice with IMU, and also she has been enrolled for her PRP through academic track. Let me welcome Carmen.
Okay. Hi, good evening, everyone. I'm Carmen from MPP 220. I'm currently in my semesters too. So I'll be sharing my experience prior to enrolling into the program and as a master student till now, right? Next slide, please. So in the final year of my degree program, I was thinking about my future career pathway and I had interest in doing a master's program in IMU. So I consulted Dr. Marikanan, which is the director of the Masters in Pharmacy Practice program. And I discovered the benefits of doing a master's program in IMU as an alumni. And these are the reasons why. So first of all, if you're doing it on a full-time basis, the completion of a master's program will only take a year. which is beneficial for me, so I could join the workforce very soon. And as an alumni, I'm very confident and comfortable with IMU's learning environment because I knew that the lecturers will always be helpful and supportive in solving students' academic problems, as well as the learning resources that are abundant, either offline or online, which is very important because as a master student, we have to go through a lot of articles in order to complete our assignments as well as our research project. During the pandemic event, we couldn't really go to campus, but all classes are delivered online. So it's very flexible for us, especially for most of my classmates, which have work or family commitments, which is very good for us. So as my major interest was actually retail pharmacy on the management level, so being able to choose a specific specialization that matches my interest is very important for me. So IMU's master's program allows us to choose a specialization that matches with our future career plans, which is very good for us. And as an alumni, we are entitled to 25% discount, which lightens the financial burden of us, especially during this pandemic season. Being a fresh graduate and joining the master's program almost immediately, I have to look into the PRP opportunities as well. So doing a full-time master's program, I'm also allowed to do my PRP training with IMU. So it's like a two-in-one package for me. I can complete my master's program as well as my PRP training in just one single year, sorry. Okay, next. So I've done my semester one, and I could say that I'm really happy with the modules that are being taught. So the new subjects that are being taught, such as entrepreneurship, pharmacoeconomics, pharmaceutical marketing, all of these modules really give me an insight, not just only on the retail level, but the whole pharmaceutical marketing and business level. And these modules are being taught by lecturers that are experts from a pharmaceutical marketing background. So even though most of my classmates, they are not from this background, we could learn a lot from their experiences when they share it with us. And we are also required to complete and postgraduate research. And I could say that it's an honor to be able to participate and conduct postgraduate research under the mentorships of lecturers, IMU lecturers that publish a lot of articles. So really grateful for that. And as compared to my degree program, my master's program has a relatively very small class size, which is good for us actually, so that all of the lecturers can give us adequate attention and personalized feedbacks to every single student, so there's no left out in class. So in IMU, all of our postgraduate research have fundings up to 10,000 ringgit for the whole project. So it means that when we are conducting our research at IMU, there's very minimal financial restrictions. We can basically do anything we want with proper budgeting, actually. So I have three mentors, my PRP mentor, my research mentor, and my principal mentor. All these three mentors, they are very experienced lecturers from the pharmacy background. And I feel very safe when I consult them regarding my future plans, my whole PRP training application process, my research planning, all those. I feel very safe when I talk to them regarding this. I knew that they would always be there for me to support me throughout this whole master's program. I'm really grateful for that. And during this pandemic season, actually having a weekend class with a very flexible schedule allows me to do part-time jobs and to learn other skills, which I think is very important during the master's program as well, because you're not limiting yourself to a certain program. If you're doing this, you are expecting yourself to grow personally as well as career-wise. So having this flexible schedule also allows us to explore different fields, whether or not it is related to a pharmacy background. So that's all from me. Thank you.
Thank you, Carmen, for sharing your experience. Now I would like to invite Ms. Farah Wasim, who is our alumna from MPP 119 cohort, who has recently completed her master's in IMU. She has completed master in pharmacy practice recently, last semester. I would like to welcome Farah to share her experience with IMU.
Okay, good evening, everyone. Thank you, Mr. Kana. Okay, next slide. Okay, so good evening, everyone. My name is Farah Wasim. I am a registered pharmacist in United Arab Emirates. I took my B Pharm from Sharjah University in 2017. Then I worked as a hospital pharmacist for 1 year. After that, I decided that I want to continue my education journey. So I came here to Malaysia and I took my master in pharmacy practice in IMU University. And today I want to share with you my experience. Next. Okay, so first I want to share with you my clinical experience. I did a clinical attachment in PPUM, and during that attachment, I get the opportunity to be exposed to the Malaysian healthcare system. Also, I built my clinical experience in multiple departments. Moreover, in IMU, I was taught according to the case-based learning, where I made a pharmaceutical care plans for my patients, case studies, and patient-centered approach. Okay, so it is very important to mention that during my clinical attachment, I was exposed to the warfarin counseling session, asthma medication counseling, and especially for the pediatrics. And also I was exposed to the therapeutic drug monitoring like vancomycin drug dose monitoring. And I get the opportunity to go to the Drug Information Center and explore the role of a pharmacist in Drug Information Center. And moreover, I get the opportunity to see the preparation of total parenteral nutrition. Okay, along with the clinical placement, I was taught different subjects. For example, the methodology and scientific writing. I was taught different types of research, and it was like in depth. And this helped me to decide which research I want to do in my last semester. Also, I was exposed to the SPSS software. And in the evidence-based practice subject, I was taught how to read a scientific paper effectively. For example, how to read the forest plot and meta-analysis, how to read the meta-analysis, and more importantly, how to evaluate the results if they are statistically significant or not. And also, I was taught how to assess the quality of the published article. Because as we know, as a pharmacist, we will receive many phone calls from the customers, patients, and doctors. And usually we will rely on resources. So it is very important as a pharmacist to evaluate the quality of that resource that we will rely on. Okay, moreover, during my master's, I learned about pharmacoeconomics, calculation, and Markov model. Also, I was taught how to write scientific review and how to do a meta-analysis. Okay, so this slide show my last semester, which is the third semester. I consider it one of the most important semesters because I used to learn a new thing every day. I developed my skills, like the skills of time management, data extraction, statistical analysis, and how to write a scientific review and systematic review that can be published with a high quality. And it's very important to say that my supervisor furnished me with like a continuous follow-up and feedback. And as a result, my article and my research was published within 1 month only after my graduation. Next slide. Okay, so this is my research. It was about the antiviral agent for the prevention and the treatment of herpes simplex virus type 1 infection in a clinical oncology. It was a systematic review and network meta-analysis. And as I mentioned before, it was directly accepted and in a high quality journal. Okay, so usually you will ask me what is the next step. So I can tell you that taking masters in clinical pharmacy opens a lot of opportunity for me. Now I have the opportunity to be enrolled in the academic field and to work as a lecturer. And also I have the opportunity to go back to my country and work as a clinical pharmacist in hospital. And at the end, I want to say my experience in IMU was very good. I want to take the opportunity and thank all my supervisor and my colleagues because they were very friendly and they were very supportive. Thank you so much.
Thank you, Farah, for sharing your experience. It's really nice to hear your feedback on the program. Our next speaker is Mr. Jody Wong, who is also a BPharm graduate from IMU and did his master's from UKM. Currently, Mr. Jody is working as a critical care clinical pharmacist in Pantai Hospital. He will be talking about his experience and the advantage of having masters in the clinical setting. Welcome, Mr. Jody.
Thank you for the introduction, Dr. Kanan. I'm Jordi. So thank you for the introduction. So I would like to share about some of my experience with after my master in clinical pharmacy. After that, I decided to work in Pantai Hospital, which is one of the private hospital in Malaysia. So I graduated from BPharm 5 years ago. So after my BPharm program, actually I decided to undergo my PRP training in IJN. So that was a wonderful experience. So in IJN, they actually provide clinical pharmacy services. So I was very grateful that I was guided by Miss Esther back in IJN. Miss Esther is IJN is a pediatric ICU pharmacist. So she actually gave me a lot of chances to interact with the pediatric intensivists back in pediatric ICU. And also, she also allowed me to participate in infectious disease team to provide AMS service. AMS stands for antimicrobial stewardship, and also to follow Dr. Leong, who is our visiting infectious disease consultant from HKL in IJN. Because he's a visiting ID doctor in IJN. That's why I managed to follow him for rounds. So this actually picked up my interest in infectious disease and also some of the critical care, because she actually guided me a lot in pediatric ICU. And hence, after 1 year in IJN, I decided to actually undergo Master in Clinical Pharmacy program in UKM. Because I don't think IMU offers any master program for clinical pharmacy at that point of time. So in master time, I was very, very lucky. I managed to meet a bunch of colleagues who has a lot of different, who are working in different fields. For example, there are some of them work in ICU, ortho-surgical, emergency department, pediatric ward, oncology ward, pain management, nephrology, and even respiratory. So there are actually not only just government hospital pharmacies around, there are also community pharmacies, and also another two of them, including 3 of us, are from private hospitals. So in my master's, I was quite lucky there to undergo training under certain pharmacies. Next slide, thank you. So in HUKM during my master's, I was very lucky to be trained by Miss Lau Chilan. She is an ICU pharmacist in HUKM. So she actually trains me not only just in critical care, but also in antimicrobial stewardship, because she's one of the head leader in antimicrobial stewardship in Malaysia and also in HUKM as well. And hence she guided me step by step in terms of how to conduct antimicrobial stewardship in ICU, how to talk effectively and smoothly and communicate with the doctors in order to conduct this service. So I slowly learned, initially I was interested with just infectious disease, but with the knowledge from infectious disease, actually we can do a lot of other services, so such as antimicrobial stewardship. So I learned not only just Miss Lau Chilan, but also Miss Anita. Although she was from HKL, she guided me back from BPharm. So ever since then, I keep her number, I keep her contact number. So I always disturb Miss Lau, Miss Anita to consult some inquiry regarding antibiotics, antimicrobial stewardship. So this master's doesn't just teach me how to fish. It also teach me, other than fishing, when you meet all the fishes that you fish, how to handle them, how to handle the situation when you have different type of fish. So it actually teach me a lot of things. And also communication. Communication is very important. We are conducting a lot of services, and antimicrobial stewardship, in order to provide this service very effectively, you need to do smooth communication, and that's what being taught by Miss Lau, Miss Anita to me. At the end, after the training and after met them, they also introduced me to attend certain antimicrobial stewardship workshop, and that's where I met Prof. Andrea. So in masters, it actually broadens my connections. So not only to Miss La and Miss Anita, and I met Prof. Andrea, and she's one of the infectious disease pharmacy training director from Singapore GH. So she's another of my sifu, basically. So nowadays, because I'm currently in the private sector, they actually guide me very well. They were actually, because it's very different to conduct AMS service in private sector. Do you mind share the next slide? So the reason why the private hospital actually would like to recruit me over is because of the antimicrobial stewardship component, which is part of the requirement in the JCI. So JCI is a committee international. So basically, it's just to basically it is a requirement for the hospital to be credentialed. So they are actually safe. It's a safe hospital. It's a safe hospital, and they use medication very effectively. So this is one of the criteria, and antimicrobial stewardship is part of the program. So that's one of the reasons why they recruit me over then to handle the antimicrobial stewardship. And to handle antimicrobial stewardship in the private sector is very, very difficult because all the consultants are working independently, unlike government hospitals. So all my CFO actually worry about me, scared that I might not handle the situation as smoothly because it's different bunch of doctors and it's different from government setting. But I kind of dwell in very well because what I learned from them, I start to practice in this private hospital. But although I do learn a lot of things from them, but I need to adjust and adapt in this new environment. But because of the training back in B Farm and M Farm, I think this adaptation is not too difficult. Because if I can survive B Farm and the masters, I don't think this adaptation is too difficult. And I really dwell very well. And here I am already 2.5 years. Do you mind share the next slide? And this is our antimicrobial stewardship team in PHKL. We have a lot of consultants that are actually willing to learn more about antibiotics because we don't have infectious disease consultant in this hospital. So all of them, everyone are not experts in antibiotics. So we start to learn from each other. And also, I will always do 3 monthly updates about antibiotics to them and how to conduct antibiotic stewardship in critical care units. So how to do de-escalation, how to do IV to oral switch, and PK/PD optimization. These are all parts of antimicrobial stewardship. And so far, very, very well. And our team members, not only doctors, we have our infection control nurses and microbiologists, and we work together very, very well. So we have the right team, right people, right time, and right pieces. That's why we are able to work together very well. Next slide. So because of the antimicrobial stewardship, I not only got my job opportunity in Pantai Hospital, and also because I have a master's, they invite me over to share about antimicrobial stewardship in the workshop for a lot of doctors, for a lot of surgeons. There is Sabre 3.0 organized by Pfizer. So it's a antimicrobial stewardship conferences for the surgeons. I was quite grateful for this opportunity. And other than antimicrobial stewardship, there are a lot of other areas that to be ventured into. So I'm currently in critical care area. So I'm doing critical care, antimicrobial stewardship, PPN, and also therapeutic drug monitoring in my current units. But there are also other parts that you can venture into, like geriatric pharmacy, because there are a lot of geriatricians currently start to venture into private practice. So for example, SJNC, Sangway, PHKL, we also have one geriatrician, and he's very interested to get a geriatric specialized pharmacist. And we also have hemato-oncology. Hemato-oncology is not only just cytotoxic drug reconstitution, but also able to provide a clinical service for hemato-oncology patients. for example, about their regime, and when they are dealing with neutropenic sepsis, things like that. And also, because nowadays, pain is actually the fifth, is considered as the fifth vital sign. So a lot of private hospitals are venture into pain-free hospital. So they are actually looking for pain-specialized pharmacies as well. How to give opioids safely, or you can offer some other regimes that are able to wean the opioids use, so you don't use opioids such at the high doses to reduce side effects, things like that. So, and also palliative care. We have a palliative care physician. She's also very interested with pain management, and she's also currently looking for the pain specialized pharmacists to work with us as well. So these are some of the emerging job opportunities from that we can look into for clinical pharmacy setting in private hospital in the very near time. Next slide. And this is my intensivist. My intensivist is an ICU consultant in my ICU. Currently, she works with me very, very well because she communicates only with me at the moment from pharmacy side. So she will liaise with me for all the drug dosing, drugs inquiry, things like that. So with us, we actually work together very well, and we kind of like, we are the king and queen in ICU basically. So with both of us, the patient's outcome will be very, very good, because not only just intensivist, she manage all the very severely ill patient, but with me around to optimize all her treatment. So the patient's outcome will be very good. Yeah, thank you so much for the opportunity to let me to share my experience. I would like to answer all the questions if there is any. Thank you.
Thank you, Mr. Jody. And yeah, it's really inspirational to see you going from IMU as a B.Pharm graduate, and later you did your master's, and you have become a specialist in antimicrobial stewardship. And also I heard that you are able to provide workshops, means you are able to train the pharmacists as well, isn't it, Jody?
For antimicrobial stewardship, because in private setting, it's a very, very new program, and not a lot of pharmacists have experience to deal with it. So at the end of this year, actually, PHKL is planning to organize an antimicrobial stewardship workshop, but only for private sector pharmacists. Because a lot of pharmacists, I know that they are interested to conduct this service, but they don't know how. Or they might not have the proper knowledge and don't have the proper experience to conduct this service, or able to communicate smoothly with the doctors. So this workshop is actually meant for those pharmacists to participate, and I would like to teach them personally, individually, so to guide them alone. So yeah, but this is only for the private sector.
Okay.
Yeah.
And also one thing I wanted to ask you, you mentioned that hematology and oncology pharmacists role in private hospitals.
Yes, because we have an oncology ward and also hematology ward. So hematology ward is currently headed by the hematologist. So he always want the pharmacist in there. So currently we have one hemato-oncology pharmacist over there. So to look over the oncology prescription and hematology, all the chemo prescription basically. And when the patient went into neutropenic sepsis or other chemo-related complications, she will assist with the hematologist to deal with those complications.
Okay, that's great. So when it comes to the current practices, how much the pharmacists are involved in evidence-based practice?
So evidence practice, basically we look into guidelines, but guidelines is always a guide. So just like a product insert, they will always tell you the safest dosing, things like that. But you always need to individualize your treatment based on your patient. So for example, in ICU setting, so when we are talking about PK/PD optimization in those very critically ill patients. For example, we talk about meropenem. And doctors say, oh, this patient is very sick. I want to give meropenem. I say it's fine, but you need to do a blood culture. So I will talk to them. Oh, you can start meropenem. It's fine, but we need to do blood culture, all the septic workout tracker, aspirate, and urine culture before we start antibiotics. That's one. Second, when we start antibiotic, I need a loading dose. So I would talk to them. Oh, for example, meropenem. No matter how sick kidney function, how lousy. So 2 gram loading, then followed by adjusted dosing. And we do prolonged infusion in my ICU. That's why I know how to optimize the dosing, optimize the treatment for the patient to prevent any treatment failure, things like that, and to prevent any resistance coming out. After that, when the blood culture, everything come back, any positive result, we do de-escalation. So this is how we talk about antimicrobial stewardship and also how to optimize the treatment in my ICU. Yeah. So, and also, although product insert mentions certain dosing, so for example, 1 gram, 500 milligram daily in end-stage renal failure, but I don't agree. So when the patient is when the patient went into acute kidney injury, you still, but with good urine output. So you always need to increase the dosing, not just 500 daily, but you can go up to 1 gram BD. So you follow urine output and also body weight of the patient. It's not like for example, you have a patient with just 40 kilo and another patient is 120 kilo. You don't dose them the same way. They are weight-based dosing. So you individualize the treatment based on different patient with different body weight, different urine output, and tailored to their treatment. Yeah.
Okay, thank you. Thank you so much for the detailed explanation.
No problem.
Now I would like to request the audience to keep your questions in the Q&A box. So if you have any specific questions about the program or whatever we have shared so far, please keep the questions in the Q&A box. We are happy to answer your questions. Meanwhile, I just would like to ask Farah. Farah, you mentioned that you have published a paper from your MPP research project, isn't it?
Yes.
So usually the students will take 2 to 3 months time to publish paper, but I know that you have completed recently, but still you will be able to get the paper out before you are getting your graduation.
Right.
Great. So you have completed your Viva and at the same time you have got your paper also. Can you please share your experience on working on your research and how you gone through this paper publications from your masters?
Mhm. Okay, I kind of started from the beginning. I started my last semester was during the COVID-19. It was at the beginning. So as I mentioned before, I learned how to do time management. And I want to thank all my supervisor because they helped me to put a timetable that we can follow strictly. And after that, as I mentioned, my paper was published only within 1 month because as I said before, in IMU, I learned how to write systematic review and how to write a paper that can be published immediately. All the criteria that the journals are requiring. I was taught how to write in a very effective way. So I believe this is the main reason why my article was accepted immediately.
It's really glad to see our students succeeding, in not only in terms of your academic qualification, even you are able to get the paper out as a research qualification, and it is going to be there in your CV forever. And
Right.
really glad to see that effort from you as well. Okay, my next question to Carmen. Carmen, you have mentioned that you are doing a master's in pharmacy practice along with PRP. So the PRP academic track and your MPP research are tied up, isn't it?
Yeah.
Can you please explain a bit more to our audience, like how it works?
So for us as a master student, we have to come up with a complete research project when we graduate, and which is also a requirement if you are doing this with your PRP training. But in addition to a research project, we would also be attached to hospital pantai to expose ourselves to clinical pharmacy, and it is also a part of the PRP training. So these are the two elements if you were to go through the pathway of doing your masters together with your PRP training. But if you were to compare it with the conventional mode, which is to do your PRP with either the private sector or the public sector, masters plus PRP pathway was definitely fastest than the fastest of all, I would say.
Okay, that's fine. And thank you so much. And maybe this is an open question to you all. Like, how does the postgraduate studies can help someone to stand out in the current job market? because you have gone through the postgraduate studies or you already completed postgraduate studies, especially when there is a pandemic and there are new challenges. What do you think? How a postgraduate study can help you to achieve better in the job market? Jody or Farah, any idea?
Mm, For my setting, because like for example in private sector, they always write a qualification with a master in clinical pharmacy is always being preferred if you are applying for the clinical pharmacist position. So not to say that if you don't have masters, then you are at the backside. Just that with experience is one, but they always want document. There's something that is a requirement in private sector, especially when they are talking about medical legal issues. And if you have a master in clinical pharmacy, in private hospital, that actually helps you better because in certain setting, when the doctors actually asking you for advices, then at the end they say, "Oh, what makes you different compared to other pharmacists?"
Okay.
Then you can explain a bit further that you have actually done master in clinical pharmacy. Then they will be like quite surprised that actually there are pharmacists actually willing to do further, for example, to specialize, to enter master program, to get yourself better and get more acknowledgement. Yeah, the situation, and also in management, they look you will be like a slightly upper person because you have a master degree and you actually can defend yourself much better when doctor talk about some medical legal issue with you. Yeah.
Okay, okay. Thank you so much for that. It's really encouraging for our master students. Okay, right. So, Chankaman as well as Farah, now you have been, going through this student phase during this pandemic and even before that also. So, when you have gone through this kind of situation, what about your mental strength as a student? How, you know, whether your mental strength has been tested during this challenging time?
I think it's all about self-discipline during the pandemic season because there's no one there to actually like monitor you as compared if you're going back to campus, and also the interactions with your classmates. But then that could be solved if you are willing to initiate the conversation with your classmates, your lecturers as well. You plan out your time, your assignments. As I said just now, our schedule are quite flexible, and it's actually up to the student in planning their schedules and utilizing the time to learn more. Whether or not it's related to pharmacy, I think it's all good.
Okay, okay. So any more questions from audience? Audience, if you have any questions, you can share with us. And for your information, this is day one of our PG Info Week. There are more series of talks on various programs are coming soon. You may able to check the IMU website for the details. And thank you so much for joining with us. I would like to thank personally to Jody, Carmen, and Farah for your time and your inputs and your feedback. It's really helpful for us. And also, I would like to thank all the audience who have been here with us and listening to our conversation. I hope this information is useful for you to decide on your future career plan and also to, to get into the master's degree in the future. So we thank you once again for your time and joining with us. Thank you. So for more information, you may also able to visit the website imu.edu.my, and you can always write to us at start@imu.edu.my. Thank you so much.